We're back on the record. The time is 10:32 a.m.
Doctor, I'm handing you what I have marked as plaintiff's exhibit number 5. You could take a look at that. Again, I'll represent to you that these are cell phone records that were produced in response to a subpoena by AT&T for Dr. Ng's cell phone records. At the top, you can see that it says AT&T has queried for records from 10/7/2015, 9 a.m. to 10/7/2015, 11:59 p.m. Do you see that? Do you see that?
Yes, sir.
Underneath that, there's a column that is titled originating number. Do you see that?
Yes, sir.
Do you see anywhere on that column whether your phone number appears under that?
I see my practice number on the very first one, item number 1, which is 941-485-3302. That is the number of Orthopedic Center of Venice. But I do not see my cell phone number on the originating number column.
Okay, and would this indicate to you that at 4:03 p.m. You made a cell phone call to Dr. Ng, and I'll represent to you that the number that's listed in the terminating number on the first row is Dr. Ng's cell phone number?
No, that would not.
Okay, what would this indicate to you?
The objection calls for speculation.
Yeah, I'm totally speculating, but may I answer?
Yeah.
So in the interest of trying to solve this puzzle for you, or assist you in solving this puzzle, and knowing that I'm fully speculating here, and I'm no expert at reading this chart, and also assuming that this is true, then it says, what I'm seeing here is that on October 7, 2015, at 16:03 and 45 seconds, for 14 seconds, seizure time, unless somebody had a seizure for 14 seconds, but I would imagine that is what that means. For 14 seconds, or maybe this 1 minute and 34 seconds is something else. I don't really know what those two columns mean. A phone call was made from my practice, Orthopedic Center of Venice, 941-485-3302, to an area code 917 number. And that's, so my conclusion, and then there's other columns that I do not know what that means, but my conclusion is, to the best of my ability to answer your question, is that somebody from my practice made a phone call to that number at 16:03 p.m.
Okay, and it wouldn't have been you, because I believe that you've previously testified you were most likely in Tallahassee at this point in time.
Yes, and if I would have been in my practice, I would have walked over to her and talked to her if that conversation had taken place while at the practice. So no, it makes no sense that would be a conversation with me.
Okay, so to the best of your recollection, your phone call and text messages to Dr. Ng would have been from your cell phone, correct?
Yes, although I do not recall whether I actually texted back or whether I called back. I recall calling back. Yes, I remember a conversation. I don't recall whether I texted in response to her text.
And can you tell me, if you recall, how long your phone call would have lasted?
It was a brief conversation, maybe 5 minutes at most. It was a conversation where we, to the best of my abilities, again, I'm trying to recall something that's very foggy, but to the best of my abilities, that conversation was a conversation where we exchanged information regarding the facts of the case. She gave me what I knew. I gave her she gave me what she knew. I gave her what I knew. And in the end, we agreed that the plan that she had created for that patient at that time was appropriate.
You if you recall, can you tell me whether or not Dr. Ng had told you in either a text message or the phone call that you had that John Green had been seen at the hospital on October 6, 2015?
I don't specifically recall whether he was seen at the hospital. I don't specifically recall if she told me at that time that he had been seen at the hospital. I remember she told me that there had been some sort of interim event that had prompted him to present while I was not there. So it was either interim event could have been either that he fell or that he was having more pain or that he actually presented in emergency room in addition as a result of these two other events. I don't recall those specifics, but I do recall her explaining to me that for some reason or another he was presenting out of sequence. In other words, outside of where we had him scheduled to come in.
Do you recall whether or not you reviewed any medical records associated with John Green's hospital visit on October 6, 2015, either via text message or at any time prior to the phone call with Dr. Ng?
Well, on October 3rd, when I consulted him, I reviewed his medical records at that time.
But specifically the October 6, 2015 hospital records, did you review those records prior to your conversation with Dr. Ng?
No, sir, I did not.
And you recall seeing John Green on October 9, 2015 in your office, correct?
Yes, sir.
Do you recall approximately what time John Green presented to your office?
It was my morning office.
Okay. Can you tell me whether or not he was with anyone?
He was with somebody else.
Okay. Do you know who that person was?
No.
Do you recall what that person looked like?
Caucasian. I want to guess that it was female. I can't give you much more information other than that.
And if you could, please tell me everything that you remember about when John Green presented to your office on October 9th, 2015.
So I remember walking into I remember he was in room 3. I remember he was seated at the corner chair. There's a desk in between that corner chair and another chair. The person with whom he was in that other chair. I remember he was awake, he was alert, he looked uncomfortable, meaning that he looked perhaps tired, looked like he had been drained from the amount of pain that he had been having. I remember him or the person that he was with telling me that they felt it necessary, important to come over to the office because he had started to drain from his arm. I remember immediately everything in my mind made me believe that the bone spike that I had seen the day before had finally eroded through the skin, and that we were now dealing with an open fracture. That was my immediate response, which signified that every effort that I had made to try to avoid having Mr. Green from going to the operating room was now no longer successful, and we needed to move to another type of treatment. I remember taking down, I don't remember if I took down any dressings or not, but I remember seeing his wound. And I remember seeing a circular lesion. It was about 4 millimeters in diameter. And I was impressed because when Mr. Green moved his arm, the air would suck into the wound, and you could hear it sucking into the wound. And when there were other motions in his arm, and the arm would kind of contract, you would hear the air coming out of the wound, and you would see bubbles of fluid just flowing out, a yellowish fluid flowing out of the wound. I remember looking at the wound, and I remember seeing specifically that it was not red, that it was not indurated. I remember specifically thinking, thank goodness it's not infected. And I shared that with Mr. Green and Miss, I don't know, whoever that was, in the room with him. And I remember explaining to him that we were now in a surgical emergency, or urgency, as it were, that despite the fact that he had so many medical problems, and despite the multiple risks of surgery, the high risk of surgery that he and I had discussed prior to this moment, that we now needed to change gears and go into the operating room, which was something that I felt was very important that we try at all costs to avoid in his case. He understood, he agreed. The other thing that I tried to do, and I did successfully, was to identify exactly when the oozing started. Mr. Green, when did it start oozing? And I remember both of them answered. And the answer was during the evening. And I couldn't tell whether it was before midnight or after midnight. So in other words, I couldn't tell if it was in the wee hours of the morning or at some point after he fell asleep. I got some sort of idea that maybe we were anywhere between 5 and 9 hours or so, maybe 10 hours of time since the fracture had become open. I asked him when he last ate. I don't remember what he said. And I remember immediately somehow communicating to the hospital. I can't remember. I'm sure I spoke with Doug, because that's my routine. Doug is my medical assistant at the time. To call the operating room and let them know that we needed to go to the operating room as soon as he was ready, and that whether he was ready, the time that he was ready would have been dependent on whether he ate or not. So I don't remember how that played, because I don't remember whether he told me that he had eaten that morning or not. Anyway, regardless, I booked the surgery and then proceeded seeing the rest of my patients with the intent of going to the operating room emergently with Mr. Green that afternoon.
Do you recall what you told or what you directed John Green to do after leaving your office?
Well, the general plan, and I don't know what degree of specificity you want me to give you, but as best as I can recall, the plan I would have given him was, look, I want you to go straight to the hospital. I think we usually, I don't know, Doug would have been able to decipher whether the hospital would have wanted him to go through admissions or whether they wanted him to go to the emergency room. That is sometimes where they vary a little bit. But essentially, my instructions were we're going to the hospital and we're going to operate on you today.
Do you know whether or not when he left your office that you had bandaged his arm?
I assume that we did. I don't recall it off the top of my head, but I would definitely have instructed Doug to put a dressing on his arm. Maybe if he came in without a splint, I would have probably tried to splint it as well for comfort. I don't remember that. I don't remember the specifics of that detail, but I can tell you that would have been my routine.
So do you recall whether or not when he actually came in, whether there was a brace that was attached to his arm at that time?
No, and part of that is because I didn't see him come in. Doug would have brought him back generally, or who was my tech back then, my X-ray tech back then, could have brought him back too, so that when I see him in the room, the instructions that I give my staff is the patient's in the room. If he has any dressings, we want the dressings off. So and if there's a splint that needs to be removed, they'll remove it for me. So I would have normally seen him without dressings, whether he came in with dressings or not.
Okay. And did you at any point in time order a course of antibiotics to be prescribed to John Green after you recognized the open fracture in your office?
It would have been, if I did, can't recall, but if I did, it would have been, it depends on what I was thinking. I don't recall exactly what I was thinking. I have two approaches on that. First is to start antibiotics now because for whatever reason, and I would not have done it in the office. I would have ordered it as part of my admissions orders. Or the other approach is, look, I don't want to mess up my cultures if I'm planning on taking cultures, and giving an antibiotic would definitely interfere with my ability to culture. So a lot of times, in order to protect the ability to get accurate cultures, if the patient is not toxic and he doesn't look infected, I probably would hold off until after I took the cultures to give him him or her the initial dose of antibiotic.
And it was at least your recollection at this point in time that when you saw him in your office on October 9th, that his arm did not look red or infected. I believe those were...
It absolutely did not look infected. It did not look infected at all.
Okay.
Which I remember that vividly because I thought that was one of the best in a sea of dark clouds and terrible news. That was the one silver lining, and I really held on to it very zealously because it was the only thing we had going for him. He had an open fracture. I had to take him to the operating room, which I did not want to do. He had so many multiple medical problems. I knew it was going to be a disaster. We took him to the operating room. He was just a complete risk for terrible, not just mild complications, terrible complications. And then all of a sudden I'm staring at this open wound and that had just started the night before. So we were catching him in some reasonable amount of time. And thank God he was not infected. But so I remember very vividly my impression that there was no active infection going on at the time that I saw him on October 9th.
Did you create an office note at Venice, Orthopedic Center of Venice on October 9, 2015?
I did not.
Okay, do you know whether you actually indicated in any medical record that you've ever created whether or not John Green, at the time that he presented to your office on October 9, 2015, what his arm looked like or appeared to look like?
Whatever annotations I would have made in his history and physical, which is what I created to annotate that office visit and the reasons for my going to the operating room.
Okay. Do you know whether you ever indicated in any medical record that you have created regarding John Green when the wound began to leak?
Yes.
Okay.
I did.
And which office note, or strike that, which medical record, if you recall sitting here today, which medical record did you indicate that in?
In the history and physical, in the subjective portion of the history and physical. And I remember it was important to put it there because it gives us a timing as to how old that open wound was. In other words, how long we had been dealing with an open fracture.
And I just so that the record is crystal clear, you did not create an office note at Venice, Orthopedic Center of Venice on October 9, 2015, correct?
My HMP served as my office note.
On October 9, 2015, do you recall seeing Dr. Ng at your office?
No.
Okay. Do you recall whether or not you spoke to Dr. Ng about John Green on October 9?
I know that I spoke with Dr. Ng about John Green. I don't remember when. So I don't remember if it was on October 9th, and if it was on October 9th, I don't remember if it was on the way to the operating room, after the operating room, I don't remember. But I remember that she and I talked about what happened, what transpired with our mutual patient.
Doctor, I'm showing you next what I've marked as Plaintiff's Exhibit 6.
Yes, sir.
Take a second to look at the record, and when you're ready, just look up or let me know.
Yes, sir. Ready.
Have you seen this record before, Doctor?
Yes, sir, I have. I dictated it,
Okay. And
and I signed it.
can you tell me the date that it was dictated?
It was dictated on October 9, 2015 at 3:30.
And what
That's
is
almost 4 o'clock, sorry.
what is this? What would you call this record?
This is a history and physical from Venice, for Venice, or as part of Venice Bayfront Health.
Can you read for me, or strike that, I'll read it. Starting at the history of present illness. Do you see that?
Yes, sir.
Okay. It says, Mr. Green is a 75-year-old white male who fell as part of a non-sinkable fall on 10/2/2015. He experienced immediate swelling of the left shoulder. He presented to the emergency room. He was admitted. He was found to have a proximal humerus fracture of the long spiral component. I advised that he be treated non-operatively. He followed up in my office and still had no evidence of skin disruption, although he had extensive amount of ecchymosis. The follow-up occurred on 10/7/2015. Did I read that correctly?
Yes, sir.
Okay. Is this note accurate?
Well,
Up to, and I'll withdraw the question.
okay.
Up to the part of the history of present illness that I read, is this note accurate?
Well, I will elucidate. So he was found to have a proximal humerus fracture of the long spiral component. It should be with a long spiral component. So technically, I guess that's not so accurate. The part of the note where I wrote, he followed up in my office and still had no evidence of skin disruption. I'm sorry, I'll slow down. He followed up in my office and still had no evidence of skin disruption, although he had extensive amount of ecchymosis. That was taken, that is, I guess, hearsay, but I thought it was accurate. A hearsay commentary based on the conversation that I had with Dr. Ng. I may or may not have seen records produced by Dr. Ng at that point to further substantiate that. But that is an accurate reflection of my understanding of what was going on up until that point. And then you read up to the follow-up occurred on October 7, 2015. That is accurate in that I think I had established that in so many ways that I can definitely stand to the accuracy of that comment.
Okay. You didn't see John Green on October 7th, 2015, did you?
No, sir.
You didn't treat him on October 7th, 2015, did you?
No, sir.
Okay, so the only basis that you have to say that there was no evidence of skin disruption is the information that you received from Dr. Ng, correct?
That is
Form
correct.
objection.
Join the objection.
You know, I got to elucidate a little bit more, though, because that is not the only reason. Because where I said no evidence of skin disruption, that is a combination of the information I got from Dr. Ng, plus the fact that he did not have any drainage per him and whoever was with him until the night before. So the fact that I could confidently state that he had no evidence of skin disruption was not just because of Dr. Ng and what she told me, which is probably enough, But in addition, I knew for a fact that there was no possible way that he could have skin disruption until, if you look at the next sentence, overnight over the past evening when he developed some bleeding over the area. That is the point where he developed some bleeding. So, although yes, I did rely as, I guess, corollary information, Dr. Ng's description to me, when I talked to him that morning and they told me that they started oozing that night or in the wee hours of that morning or around midnight the night before, that's when I knew for a fact that there was no possible way that that the skin was disrupted until, I don't know, 5 to 10 hours prior to me seeing him.
I'm going to move to strike the witness's narrative as non-responsive, as there was no question pending.
No, you asked the question. He was explaining.
I trust you will ask me the question.
I'm showing you what has been marked as Plaintiff's Exhibit 7.
Yes, sir.
You've seen this picture before?
Yes, sir.
Do you know what date this picture was taken?
No, I do not.
Okay, well, I'll represent to you that it was taken on October 7th, 2015. Do you recognize the setting that this picture was taken in?
Yes, I do, actually.
And what is the setting?
That is my office,
Okay.
my medical office.
Okay. And tell me, doctor, look at the upper left arm of John Green. I'll represent to you that this is a picture of John Green. Can you recognize on his left arm any abrasion or any type of skin disruption looking at this photo?
Object
No.
to the form of the question.
No, I do not see a disruption in the skin, nor do I see an abrasion.
I'm going to hand you what's been marked as Plaintiff's Exhibit 8. Have you seen this before?
Yes, sir, I have.
Okay, what is this?
This is a digital reproduction of an X-ray performed on Mr. Green in my office. The X-ray was performed on October 7, I believe, as part of the visit that he had to Dr. Ng.
Okay, and if you could refer back to Exhibit 7, what I'd like you to do is tell me if, in your opinion, the spike of the proximal humerus fracture correlates with the red mark on Mr. Green's arm.
I cannot.
Okay, so based on these two exhibits, you can't tell.
No.
Okay, I'll read the rest of, going back to Exhibit 6 for a second, I'll read the rest of the history of present illness. Starting with, however, overnight over the past evening, he developed some bleeding over the area. He came to my office today with evidence of bleeding from the left upper extremity. Examination revealed that there was continuity between the skin and the fracture. This was presumed due to the fat component of the bleeding, although I was unable to actually see the spike of the bone extruded through the skin. However, The position of the wound correlates with the position of the tip of the fracture spike. Did I read that correctly?
Yes, sir, you did.
Showing you what has been marked as Plaintiff's Exhibit 9. Have you seen this record before, Doctor?
I'm not sure.
We'll take a minute and review it if you need.
Yes, sir.
This appears to be a medication administration record, correct?
Yes, sir.
From Venice Regional Bayfront Health?
Yes, sir.
And the patient's name appears to be John Green. Do you see that?
Yes, sir.
And at the top left, there's a date and some times that are listed there. Do you see that?
Yes, sir.
It says October 9, 2015, 7:01 to October 10, 2015, 7:01. Do you see that?
Yes, sir.
So this is basically part of a medication administration record for a 24-hour period. Is that fair?
Incomplete, but yes.
Okay. And it says in the first box, do you see where it says clindamycin, Cleocin, 900 milligrams? Do you see that?
Yes, sir.
And it says start 10:09, 1600 hours. Do you see that?
Yes, sir.
Then it says stop at 1959 hours. Do you see that?
Yes, sir.
Okay. And then a little further down it says refrigerate, send now to ACU. Do you see that?
Yes, sir.
And then on the right, all the way in the third box on the right-hand side, it actually says not given, reason, meant to be given in OR. Do you see that?
Yes, sir.
Okay, so what does this medication administration record indicate to you?
So this is an order for clindamycin, or this is representing a record of administering clindamycin to the patient. That would have been, I assume, it would have been in response to an order that I gave, because it would make sense that it would be so, especially since it was 900 milligrams, which is slightly on the high side of clindamycin dosage. The reason why I would have chosen clindamycin is because if I refer you back to the history and physical, the patient was allergic to penicillin. So my primary modality, the preferred medication, which is Keflex or Ancef, which is a first-generation cephalosporin, was not available to me because of the patient's allergy to penicillin. So I chose the recommended medication for patients who have penicillin-type allergy, which is clindamycin. Now, this, I don't know how this box on the top left gets generated, but nevertheless, it appears that this was an order that I asked for the antibiotic to be given in the operating room. Generally, we give the medication preoperatively. So if it was held until the actual operation, then what had happened was, again, I'm conjecturing and I'm reconstructing this using my normal method of practicing medicine. What would have happened is that I would have held the medication until after I got the cultures. I must have been thinking already at this point that I would like to get cultures intraoperatively, and that I did not want to have that ability to get cultures ruined by the effects of the antibiotics. So I probably asked the staff to hold off on the clindamycin until I gave the go inside the operating room.
And why would you take cultures in the operating room?
You know, I generally don't. I generally don't take cultures in an open fracture, and the reason for that is because of the high level of contamination and the lack of any significance. to the results of the cultures. You can't do much information. You can't do much clinical conclusions with the cultures. But Mr. Green had a very unique set of circumstances. Number one, he was presenting not with a brand new acute fracture, but with a fracture that had been open by, if this is true, 1600. It now had been open for more than 6 hours. Second, I saw fluid oozing in and out of his arm while I was in the office, and I had to assume that that had been going on throughout the whole evening. So my logic was, and I do this on rare occasions, such as this one, in the hopes of being able to identify bacteria that are contaminating the wound, so that if he does get infected, say 48 hours later, I don't have to then wait another 72 hours to find out what the best antibiotic was. So I know that was a long kind of recitation of my thought process, but I'll give it to you again in a summary. What I wanted to do was and I don't normally do this, but I did it because of the uniqueness of this case, was I got a culture knowing that it was not infected, so that if he were to get infected later on, I would have an answer as to what bugs were contaminating his wound a lot faster than if I would have done it, number one, after giving him antibiotics, and number two, after waiting for 48 or 72 hours or even longer for the infection to appear. I did not want to delay his treatment unnecessarily. So I thought it would be smart and proactive to at least know what was contaminating his wound at that time, so that I wouldn't have that unnecessary delay in treatment later.
Okay, and how did you know that it wasn't contaminated at that time? And I
Form.
Yeah, objective form.
okay. Can you read back the narrative that he gave us?
He said infected, not contaminated.
Okay, so I'll withdraw the question. How did you know at the time that you sent John Green to the emergency room? How did you know that it was not infected?
There was no redness. There was no induration. There was no purulent material. There was no dysvascular material around the area that looked like pus in the making. There was other than the fact that the wound looked, traumatized, and other than the fact that there was an open wound with clean serosanguinous material flowing inside and out of the wound, there was absolutely nothing unusual about that skin. There was ecchymosis around the area, granted, but there were no telltale signs of infection when I examined him and I laid hands on his arm on October 9th. There was no redness, there was no purulent drainage, there was no induration, there was no thick swelling like you see in cellulitis, there was none of that. All there was a edematous wound, as you would see an edematous arm, as I saw from day one. And number two, unfortunately, this time there was a hole in it. But there was absolutely no other evidence to indicate, no evidence, period, to indicate that there was an infection going on.
So it's your position then that the fluid that was flowing from Mr. Green's arm was completely clear. That's your position?
Completely clear.
You just indicated that the fluid coming out of his arm was clear.
You're using my words. Let me. I would have appreciated if you just had me further clarify what I meant by completely clear. What I meant by the comment that was completely clear was that it looked like edema fluid. It did not look like pus. There was some blood tinge to it, as I would expect, because there's blood flowing in and out of the fracture. But there was no, in pus, when you have pus, you have dissolved material, dissolved fatty material. You have all sorts of thick material. It can look like milk. It can look like reddish yogurt. I mean, it has all sorts of different consistencies. When you have non-infected material, it looks like what you would expect when you cut into a wound, into an incision, and there's the free flow of swelling from that incision. you have a thinner, clearer, yellowish amber fluid that if it's blood tinged can be pink in color. But when I meant clear, I'm not sure what it looks like in a test tube. If we were to put it in a test tube and look across the test tube to see how clear it would be. But what I'm referring specifically is that there was no evidence on that material that material was in any way infected or associated with any debris that was being, maybe the term is opsonized, because the bacteria are eating away at the surrounding tissue. That clearly did not appear at the time that I evaluated him.
Do you know approximately what time you arrived at the hospital?
No, sir.
Okay. Do you know approximately what time the surgery with John Green began?
If we look at the medical record, we'll probably find it, but I don't recall off the top of my head.
Okay. Do you recall off the top of your head specifically how long the surgery lasted?
I can tell you it lasted about 2 hours, but I don't recall with any specificity as to, and I say that because that's how long it usually takes me to do that case.
Do you recall what type of surgery John Green had?
I did a debridement and irrigation. So what that means is that I extended the wound. I removed the puncture wound. I extended the wound up the arm and down the arm and made my way down to the tissues below. I washed it thoroughly. I cleaned it out of any material that I could potentially find that would have contaminated it. I did not find any gross contamination. And then I performed what's called an open reduction and internal fixation procedure, which is where I put the bones back together and I put a plate with screws to hold it back in place.
And you did take a culture of the humerus bone spike during that surgery, correct?
Yes, sir, I did.
Okay. And you sent that to pathology, correct?
I give that to the nurse. The nurse takes that to microbiology.
Did you ever speak with Dr. Ng following that surgery?
I'm sure I did. I don't recall specifically when, but I am willing to guarantee you that she and I spoke about that case multiple times.
Do you know if you spoke that evening after the surgery?
I don't recall that.
Sitting here today, do you know whether anyone contacted her regarding the results of that surgery?
I do not, other than the conversation that I'm sure that I had with her at some point.
Did you ever see John Green again after the surgery that evening?
Sure.
Okay. Approximately how many times, or if you recall how many times?
I rounded on him. See, I definitely saw him the next day. I saw him the day after that, where I did my wound check, where once again I found no evidence of infection. I know that I saw him maybe one or two more times, and if I recall, his post-operative course, predictably, was not complication-free. He developed problems with mental status. He was very somnolent, and I remember getting an internal medicine consult to assist me in taking care of him, and I can't recall if I transferred him to their service or not. If I had transferred him to the service, then it's possible that he continued to be taken care of in the hospital and that I did not see him absolutely every single day. But to answer your question, I definitely saw him post-op day 1, I saw him post-op day 2, and I may have seen him one or two more times in the hospital before he got discharged.
Do you recall at any point when you were in the hospital whether you had requested an infectious disease consult for John Green?
I did not. There would have been no reason for me to request an infectious disease consult because there was no infection in the wound.
showing you
Thank you.
what has been marked as plaintiff's exhibit number 10. Have you ever seen this medical record before?
I do not recall seeing it.
Okay, what does it appear to you to be?
It is a set of post-operative physician orders at Venice Regional, and it appears to be regarding Mr. Green. And somehow it does, oh yeah, and it says that it's signed electronically by me, so it would have been, it appears to be post-operative orders at Venice Regional regarding Mr. Green following his surgery, and they are dated October 10, 2015 at 1:21 in the morning. And so therefore these are the orders that followed the surgery that I performed on Mr. Green.
Okay. And if you could look at, it says order, date, and time. Do you see that?
Yes, 10/10/2015, 1:21 in the morning.
Does that make sense to you?
The day, yes, it would make sense if we went late at night. I don't recall whether we went late at night. If we went late at night and finished in the wee hours of the next morning, then it would make sense that I wrote those orders at 1:21 in the morning on October 10th.
Okay. And if you could skip down to order number 9, do you see that?
Yes, sir.
Can you, well, it says clindamycin 600 milligrams. You see that?
Yes, sir.
And then it says IV. You see that?
Yes, sir.
Okay, so was this clindamycin being administered through the IV that John Green had?
Yes, sir.
Okay. And then it says Q6. What does that mean?
Every 6 hours.
Okay. For 24 hours times 24 hours, do you see that?
Yes, sir.
Does that... And tell me if I'm wrong, but I'm interpreting this as clindamycin 600 milligrams every 6 hours for 24 hours.
Yes, sir.
Okay, and am I correct in that?
Yes, sir.
And then there's an arrow next to it. You see that?
Yes, sir.
It says, it looks like pre-op 2250, and then says set 0110. Do you know what that means?
I have no idea what set 0110 means.
Okay.
Pre-op 2250, pre-op means pre-operative. 2250 appears to be a time, which is 10:50 at night.
Okay, do you know why there would be an arrow with this information after that order?
No, sir.
Okay. Any idea what this is indicating?
No, sir.
So these were orders that were given, at least if we're assuming that these orders were given after John Green had completed his surgery.
Yes.
Why would it have been important to prescribe an antibiotic?
It is the recommended prophylaxis treatment against infection for an open fracture in a patient who has a penicillin allergy.
Okay, but again, in your opinion, he did not have an infection at that point.
Like I said, prophylaxis, which means prevention of an infection. This is pretty much the textbook academy recommendation for the prevention of infection that in a patient with penicillin allergy is you give him some sort of substitute antibiotic that is not a penicillin derivative because the patient is allergic to it for 24 hours. In this case, the preferred and recommended antibiotic is clindamycin, and I ordered it for 24 hours.
So I'm going to show you what has been marked as Plaintiff's Exhibit 11. You've seen this record before, Doctor?
I can't recall.
Okay, what does this appear to you to be?
It seems to be the typed portion of the record seems to be identical to the typed portion of the other record you gave me, except this one says copy on it next to physician orders. The words pre-op 2250 are now substituted by words pre-op 2215, set 0110 PACU with a crossed zero sign. I have no idea what that means. And then at the bottom it says, it has a stamp that says that it was faxed PACU 0135. I don't know why you have two different versions of what appears to be the same set of orders, but nevertheless, one is apparently denoted to be a copy of the other.
Okay. And the writing that appears after the number 9 on this physician's orders, that's not your handwriting?
No, sir.
Okay. And the writing that indicates PACU and then a 0 with a cross through it, do you see that?
Yes, sir.
Does that indicate to you that clindamycin was not given in the PACU?
I have no idea what that indicates.
Okay.
I have no idea what this whole pseudo quasi English sentence is supposed to indicate. If I were to really conjecture, I would say that this is some sort of nurse's documentation of something, but I have no idea what it means.
I'm going to give you what has been marked as Plaintiff's Exhibit 12. Have you take a look at that record, Doctor? Have you ever seen that one before?
I don't recall one way or the other.
What does this appear to you to be?
It's a medication administration record spanning from October 10, 2015 to October 11, from 7 o'clock to 7 o'clock in the mornings, respectively. And it is regarding Mr. Green, and it's at Venice Regional Bayfront Health.
Okay, and I just want to correct you. This appears, at least to me, to be a medication administration record from October 9, 2015 at 7:01 to October 10, 2015 at 7:01.
That's not what I see. I see October 10, 2015, 7:01 to October 11, 2015, 7:01.
All right, well, let's set that aside for a second.
We're still calling it Exhibit 12?
We'll still call it Exhibit 12, correct? I'm showing you now what has been marked as Plaintiff's Exhibit 13.
Okay.
Do you have a copy of that?
Yes. What is the... What does this appear to you to be, Doctor?
So this appears to be a medication administration record from October 9, spanning from October 9, 2015 to, I'm sorry, from October 9, 2015 to October 10, 2015, 7:01 to 7:01 in the morning, regarding Mr. Green at Venice Regional Bayfront Health.
Okay, and a little more than halfway down the page, do you see, it says clindamycin phosphate, do you see that?
Yes, sir.
Okay. And on the right, all the way on the right hand side in the third column under 1901-701, that would indicate to you that this is a medication record that spans from October 9th at 1901 to October 10 at 7:01 a.m. Correct?
7:01 to 19:01. I see. Yes, I believe that.
Okay. And I think I've mixed military and regular time here. So just to clarify, this spans from October 9, 2015 at 7:01 p.m. to October 10, 2015 at 7:01 a.m. Correct?
No.
Okay.
No, this would span, which, the sheet itself spans from October 9, 2015, from 7:01 a.m. to October 10, 2015 to 7:01 a.m. The first column spans from 7:01 to 19:01, which would be 7 a.m. to 7 p.m. And the far right column would indicate 7 p.m. to 7 a.m.
You're absolutely correct. And what you're referring to is 7 p.m. on October 9th, 2015 to 7 a.m. on October 10th, 2015, correct?
Yes, sir, I am.
Okay. So if we go back down on that third column, where it's indicated that clindamycin phosphate has been ordered on the medication administration record. Do you see that?
Yes, sir.
And then on the very far right-hand column, it says 520 JP 600 milligrams. Do you see that?
Yes, sir.
So does this indicate that at 5:20 p.m. on October, excuse me, strike that. Does this indicate that at 5:20 a.m. on October 10, 2015, that clindamycin is ordered?
No.
Okay, what does it indicate to you?
I have no idea what it indicates. But if I were to guess, I have no idea what it indicates. But
Okay.
it is not, this is not you said that it was ordered. This is not an indication of an order. So, so whatever it indicates, this cannot be taken as a reflection of when something was or was not ordered. If anything, you can probably make certain comments, and I don't know that I can, because I don't do this. I don't make these documentations in the chart, but it may be more likely giving information regarding when it was administered, but not when it was ordered.
Okay, and that's fair, doctor. The medication administration record says order not found in system / reason, and then a colon, new order / pharmacy closed. You have any idea what that means?
No, I don't.
Can you tell, based on this record, whether medication of clindamycin phosphate was administered at 5:20 a.m. on October 10, 2015?
Without having more information about what these various documentations mean, I'm afraid I cannot.
Okay. So let's go back to Exhibit 12.
Thank you.
I believe that we discussed before that this is another medication administration record.
Yes, sir.
And this spans the period of time October 10, 2015 at 7 a.m. to October 11, 2015 at 7 a.m., correct?
Yes, sir, it does.
Okay. And in the very last box on the left column,
On the right, or?
the very last box on the
Oh.
left column,
I'm sorry, yes, sir.
it says clindamycin phosphate, Cleosin 600 milligrams. Do you see that?
Yes, sir.
Okay. Can you tell, based upon this medication administration record, when John Green would have received clindamycin?
Again, not being the one who creates these orders and I mean these annotations and creates these records of administration, plus the fact that then for whatever I may have, a nurse may have put in there, then gets placed on some sort of computer generated table. The answer to your question is I cannot. I would have to ask one of the nurses at Venice Regional to explain to me what these numbers and what these initials mean.
Okay. So, is it fair to say that, based on your assumption that the fracture did not become open until some portion of either the evening hours of October 6th to the early morning hours of October 7th. Correct? That was your
No.
assumption?
No,
No.
no, October 8th to October 9th.
Excuse me. Okay.
That's what you want it to be.
No,
but that's
no.
not what it was.
So we want the truth, Marjorie.
Well, then you wouldn't have struck my explanation to you on the pending question.
So if we use your assumption that the wound was not open until the late evening hours of October 8th to sometime maybe in the morning, the early morning hours of October 9th.
Yes, sir.
If I assume that clindamycin was not administered until until October 10th at 9 a.m.
No, that wouldn't not be a correct assumption.
Okay. That wouldn't be a correct assumption because why?
Because I ordered the medicine to be given inside the operating room. You have circumstantial evidence that the medicine was pulled and held preoperatively because I had told them that I wanted it in the operating room. And I remember clearly after I took the culture sample that I told them, okay, you can give them the antibiotic now. Remember, these are 600 milligram medications, and I had ordered 900 milligrams for in the operating room. So my conclusion, I can't tell you too much about the timing for subsequent post-operative. And I'll give you one more bit of insight as well. I cannot tell you too much about the timing of post-operative medications, but I can tell you that my assumption and pretty much my confidence is that he received his first dose of antibiotic immediately after me taking the culture inside the operating room. That would have been a 900 milligram dose. Additionally, for whatever reason, you can ask the nurses and the nurse administrators at the hospital if you depose them. They like to give the second dose in PACU. So more often than not, the second dose gets given in PACU, which is a source of contention because I kind of don't think it's necessary, but that's the protocol. So I would tell you that my confidence is that he got his first dose inside the operating room, that he likely got his second dose in PACU, and then these are subsequent doses.
Okay. Do you know which medical record I could look at to determine when the first time John Green was given an antibiotic? I
would venture to. I don't know. The answer is I don't know. If I could help you, perhaps the anesthesia record may be a place where they would document that. But I honestly can't tell you. Because I don't create those records. I create the records where I see the patient every day, and I annotate my findings, and I annotate my treatment plan, but I'm not in the habit of annotating when patients receive their medication, so I would have to defer you to somebody who does that routinely.
I'm handing you what has been marked as Plaintiff's Exhibit 14.
Yes, sir.
You ever seen this record before?
I'm sure I have. I can't recall.
Okay. Do you see it says authenticated by Julio Gonzales, MD? Do you see that?
Yes, sir.
And the date is 10/15/2015 at 12 p.m. Do you see that?
Yes, sir.
And at the top of this record, it says D/C clindamycin. Do you see that?
Yes, sir.
Do you understand that to mean discontinue clindamycin?
Yes, sir.
Okay. And who would have had the authority to order the discontinuation of clindamycin?
A, any doctor, but specifically probably me. B, I don't think I gave this order. You want to know why?
No, not
Okay.
right now.
All right, I'll let you digest that.
But this was authenticated by you on 10/15/2015, correct?
Yes, there are many times when we go back. So the chart gets done, and the patient gets discharged, and the chart gets assembled. At this point in the history of the hospital, the chart was being scanned, And then anything that medical records review was identifying as not signed, because without the electronic portion, the typed portion of this copy, there is no indication here that I actually signed this order. They put this into a computer software program where the doctor can then come back at a later time, in this case was October 15th, can come back at a later time and sign the orders or disagree with the orders or write notes on the appropriateness of the orders if it's not an order that they were given. Not infrequently, I get these orders that are like redundant orders that make absolutely no sense, but for whatever reason the nurses put it on. So for example, this is T.O. Dr. Gonzales. It says it was a telephone order by Dr. Gonzales for William Sargent, who is a nurse who I know who this person is in the hospital, and that it was done at 13:35 and 10:11. I don't think I would have given this order because my order had an automatic stop date of 24 hours. So either Bill, that is Mr. Sargent's name, Bill either called me for clarification and I told him, yeah, look, we don't need to continue with the clindamycin, or in order to comply with whatever documentation, advice, or directions he's given, he wrote this. When I come by on October 15, I look at this and my thought is, I probably didn't give that order because it had an automatic stop order, but I'll sign it nevertheless because otherwise it would cause a significant problem, and it was in the spirit of what I had ordered anyway.
And what was the significant problem that it could have caused if you didn't agree with this order?
Honestly, that would probably go into, it's after the fact, right? And the clindamycin was already discontinued, and I think maybe the patient may have already been discharged. So physically, in reality, it wouldn't have caused any problems. But administratively, and in terms of the hospital's compliance with having doctors co-sign a certain minimum percentage of orders successfully so that they can maintain compliance with JCO, which is the overseeing organization for Medicare patients, it could have caused that kind of a problem. So I, in order to avoid that, I cooperate unless the order disagrees with something that I did not want to have happen. Then I won't sign it and I'll document my reason why. Or if it's another doctor's patient, or clearly another doctor's order, and then I will document that, and then they'll call me or they'll research it further. But in this case, because there was going to be no consequence of me signing the order, and because there could have been administrative consequences of me not signing the order, I did.
Okay.
Authenticating, I guess, is the word that I should have used.
And by authenticating, you did not disagree with this order at that time?
No, I did not disagree with that order at that time because it should be in keeping with my automatic stop order of clindamycin IV Q6 hours for 24 hours that I gave at 1 in the morning on October the 10th. And again, I did that because it was in an effort to prevent infection, not treat infection.
And I think we need to go off the record for a second so we can get some more exhibit stickers.
We're going off the record. The time is 11:41 a.m.
For the restroom.